So I'm going to start with my title. This is me, and this is my email address for further communication regarding my topics. So I'm going to share a bit about the work as avian veterinarian and the conservation work and some raptor research. And before we start, I think everybody know very well about raptors. I just love this species, and they are very good eyesight for detecting food at a distance or during flight. And this bird very strong feet, talon, grasping for the prey, and also very powerful beak, especially when we handle them for treatment. And as everyone knows, that there are two categories of raptors: the diurnal raptors. This is the daytime predators, and also nocturnal raptors, which is nighttime raptors. And from yesterday and maybe previous years, when we talk about raptor conservation and work, there is a lot of current and way forward initiative, and through research on raptor surveys, advocate and conserve key raptors habitat sites, establish networks and collaboration with local universities and international as well as NGOs, community engagement through education and awareness. A lot of work has been done from various parts of the world. It is a very good effort towards conservation of the species. And not to forget expanding the research in avian medicine and surgery, which is a veterinarian involved in this part and as a role of conservation for the veterinarian. Of course, Dr. Puan already shared with us about raptor research in Malaysia. And we know that there are, most two main areas such as raptor migration, as well as raptor ecology habitats, a lot of study on composition, species composition, population and trends, root of diversity. These involve MNS, AR, CCN, local universities, and other sectors. So I'm going to share about avian medicine because I'm a veterinarian, and I would like to share about the avian medicine field and what we do to help this species. Actually, when we talk about avian medicine, it is the science or practice of diagnosis, treatment, and prevention of disease. So today we are particularly talk about raptors. And if you, as a vet, we have a lot of books to look at when we treat animals, as well as journals, research work. What are the research ongoing? So a lot of books on raptor biomedicine, birds of prey, raptor surgery. These books, most of the books, they are wrote by various vets that specialize in raptors as well as in avian medicine in general. So when we talk avian veterinarian, it is someone that specializes in treating birds. And normally for the vet student after graduation, normally we are practice to treat any species, and then later additional training required for qualification to become specialized in maybe avian medicine, surgery. And for myself, I specialize in the care of birds, various species of bird, including raptors. So this is a place where my training at the University of Minnesota a long time ago, but of course we're still networking with my group. And this is the team mixture of the professors, the vets, as well as the technical. So at the Raptor Center, University of Minnesota, with the exposure on treating, care, and rehab, so I use the model or guide for raptor biomedicine and rehabilitation for Malaysia. And through networking with penelitian and also educating doctor of veterinary medicine students through the addition of raptor medicine in doctor of veterinary medicine curriculum, as well as knowledge sharing for vets and students on must-know techniques and raptor disease through various workshops, seminar, and research. And then when we talk about disease, there are infectious diseases, disease agents such as fungal, viral, bacterial, endoparasite, and ectoparasite. And when we talk about non-infection, common problems such as traumatic injuries, toxicity, and others. So as vet duty, there are basic steps A to Z about transporting the birds to the clinic or maybe found by publics, taking the history, examining the bird's attitude in the cage, and also looking at the droppings of feces, restraining the birds because with raptors, we need a specialized way, examining the birds, and then provide the diagnostic procedures to look at the X-ray, blood work, maybe endoscopy, and other various diagnostic procedures, and then proceed with treatment plan, rehabilitation process, and also at the end to release to the wild or in captivity, depending on the severity. So this photo shows various activities that related to vet work. The first one, you can see the handling and then taking blood, X-ray positioning, and the bandaging technique in birds. And eye examination also important in raptors, especially when involvement with head trauma, where the fundus or the back of the eyes need to be further evaluated, especially for the owls and also eagles. With small bird, maybe a bit difficult. So with the bigger size bird, it's much easier because it is important to evaluate the eyes so that we know that the bird is okay when we want to release them back to the wild. So now because my interest in fracture repair, I have two cases that I just want to share with all of you about fracture case that related to trauma and also involvement of soft tissue injury, where the two cases, the first one is related to the using external coaptation, for example, the use of bandaging techniques. And the second one is more towards the repair using surgical intervention. So the first one is fracture repair using bandaging techniques or external coaptation, which this technique is very easy to apply. And I think, it's good to practice and learn the techniques in the future. Or maybe current, some of you already know how to conduct this procedure. So let's share a case of left tibial fracture. This is a leg fracture in crested serpent eagle. This is an adult crested eagle with a problem when admission, unable to stand, non-responsive. It shows freaky behavior. And then on physical examination, the bird was on sternal recumbency, but it's alert. And what we found that during examination of the leg, there is a crepitus felt. You can feel that the swelling area. And at the same time, it shows a poor grasping reflex, a sign of abnormalities in nerve function of the leg. So in this case, we proceed with the X-ray positioning of the dorsal ventral view and lateral view to evaluate particularly the area that affected, especially the leg. And in this case, that you can see that a little bit, this X-ray a little bit dark, but you can see that there is pieces of bone. It shows comminuted fracture. And what we decided at that time is because of the alignment not so bad, and it's quite difficult to manage with the surgical. And we thought that with Robert John Bandage technique, we're able to help the bird, and hopefully the leg will heal. So for this case, this is the end product of the Robert John Bandage technique in this bird. And then you can see that the bird able to stand by using both legs 2 days post bandage. And then at day 8 post bandage, you can see that the bird put weight support on the left leg that was injured. So this is the X-ray 5 weeks after we remove the bandage, and you can see that although a little bit mild line of the fracture area, but you can see that the bone heal nicely. And what we found that the leg function is very good post removal of the bandage. So you can see that from this X-ray, the bird able to stand, and it has shown a very good prognosis for this case. And at the same time, when the bird in captivity, it is important to evaluate the foot pad so that the leg function will be good when we release. And prognosis for this bird is very good, and the birds was released to the wild. So for the second case, fracture repair using surgical technique. So this one, it is a spotted wood owl, where we use the external skeletal fixator, intramedullary pin tie-in, or you can call it tie-in fixator. This is one of the gold standard for repair of a fracture in a raptors. So this is spotted wood owl. You can see that from the X-ray, it has a fracture of the wing. This is the humerus fracture, and then it is open fracture. So in this case, we decided, because of the with the condition of the fracture, to repair using surgical techniques, where as a procedure, the bird need to put under general anesthesia, hood, head, using isoflurane inhalation, then continue with the normal procedure for treating the fracture repair. So this is example where we did fluid therapy, especially this procedure is needed, especially when the bird we bring to surgery. So this is the skin preparation to get ready for the surgical exposure site. Feathers was plucked, especially the downy feathers or the covered. So, but please don't forget, don't pull the primary feathers, because it is an important feathers for flying. So this is the photo during the surgery and part of post-surgery after the position of the pin. If you can look at here, the position of the pin during the for the surgery, the pin in the bone and the fracture site. So of course we have to take an X-ray during the surgery. This is the position of the bird when we took an X-ray, and you can see that the pin in the bone and the external fixator. This is before the tie-in of the pin, so that it become a rigid fracture stabilization technique. So then application of the bar to create a connection that's stable. And then by using acrylic to fill in the Penrose drain, as in this photo, because Penrose drain and acrylic bar is very lightweight for the bird. So after the surgery, you can see here, is this a photo of the bird during the recovery and checking of the pin site. We put antibiotics at the pin site to prevent infection, and put some gauze at the fracture site, and at the end, application of the figure-8 bandage to support the wing, so that it won't be so painful and heavy for the first couple of days of the treatment. So this is a photo of 4 weeks post-surgery, where the cutting of the part of the pin so that it will have some movement at the fracture site, so more bone will be accumulate at the fracture site. It is like bone biomechanics. And this is like X-ray at 6 weeks, where you can see that good bone formation, and at the end, the pin was removed from the body of the bird. Okay, the prognosis of good, and the bird also was released to the wild. And for your information, most of the surgical cases, we or non-surgical, we need to provide with the painkiller, such as butorphanol and maybe other drugs, and antibiotics needed, especially with open fracture. And we need a cage rest. And after that, there is a process how to evaluate the fracture site a day after surgery, and subsequently week by week to evaluate the fracture site and the healing of the bone. So this is a step for veterinarian for fracture evaluation step. We take an X-ray at 2 weeks. This is X-ray number 1. Because this is an important stage, especially to evaluate whether is there any infection at the bone, especially when we deal with open fracture. Then the second X-ray at the 4 weeks, and then the third fracture at 5 to 6 weeks, which is for your information, bone healing in birds, it takes about 4 to 6 weeks. And in young birds, sometimes it's faster, sometimes at 3 weeks of treatment. And then continue with rehabilitation process, physiotherapy, and flight test. So for rehabilitation process, we know that the major objective of rehabilitation is to make sure restoration of the health of the bird, and then physical and mental conditioning if you deal with the juvenile birds, and also release to the wild, with exception of survivorship at the suitable time and at a suitable place. And then we make sure that when we release the bird, fully functional of the appendages, such as their talon, their helix, the talon of the bird, and also good visual capability, especially the eye function, good athletic ability, especially the wing function of the bird, leg function, and appropriate social conditioning, especially when you deal with the young bird and how they mix with adults, and make sure that they have ability to hunt on their own, and so that after that it can be released back to the wild. Okay, propatagium is very important tissue that connects shoulder to the wrist, and this important especially to evaluate the range of motion of the wing of a bird after fracture. Okay, followed by treatment techniques for the eyes, treatment techniques for oral medication, for the injection medication, subcutaneous medication, and also when we give oral medication, make sure take care of the tracheal opening of the bird, because sometimes accidentally it can go to the trachea. So not to forget to make sure this all bird that injured receive hand feeding food formula by tube feeding or hand feeding. Sometimes the bird able to eat on its own, that one shouldn't be a problem. Imping feathers in raptors, this is another procedure that important, especially when there is the raptors, the primary spot feathers is damaged. So by doing these imping feathers, the rehabilitation process or timing the bird in captivity will be shorter after healing or after the bone heal. So the time, the span in captivity will be shorter, and it is good for the bird for the survivability. Okay, let's move on to the avian medicine, raptors and research. When we talk about avian medicine and the raptor research, a lot of study has been done on disease occurrence, detection of disease agent, toxicology, breeding problems, clinical studies on treatment of injured birds and others. So for example, for veterinarian, there is a lot of platform where veterinarian from any parts of the world, we shared about the role of vets, where we conduct maybe some disease checking, ocular ultrasonography. There are so many disease on study about disease, study about procedure for raptors. In this slide, you can see that not just raptors, is also in other species of bird. So this is a platform for the veterinarian to meet and share. And for Malaysia, Associate Professor Dr. Hafizi, and I also involved in his project about working on barn owls, especially rodenticide toxicity some time ago. And this group also has been, a lot of work has been done and carry on by different group from USM and others. And I'll also share some of my work, especially when dealing with this bird, especially treatment with Bangladesh group. And also some work on antibiotic beads, especially when we work with birds with open fracture, wound, because by doing this proper way of medication, it helps further healing of the bone site of the or at the surgery site. Okay, in 2019, I presented one of the case where we work on management of malunion fracture in birds. This is a special case where sometimes the alignment is so poor. When a public or someone found it and bring it to us, we have to repair the fracture and help the birds. Okay, since I'm interested in working on bone graft for birds, because throughout my experience, a lot of fracture repair and a lot of cases also with bone loss. So we found that because of lack of bone in birds, a lot of study need to be done, especially using pigeon as a model to prepare a bone graft and also bone protein, so that we hope that by conducting this study, we're able to contribute to the bone graft work for raptors, especially when bone graft work is needed, especially to repair a fracture repair with the osteomyelitis cases. Okay, last part, I would like to share about One Health. We know about treating birds, but we know as a veterinarian and also biologists, conservation, NGOs, we have to work together when we deal with One Health. Last time we heard about One Medicine. So now we talk about One Health. We have in Malaysia, the Malaysian Raptors, the Malaysian One Health conservation that work on One Health. It integrates all factors affecting health, human and veterinary medicine in various areas, such as epidemiology, the politics, research, ecology, social science, and economic. So One Health Vision, actually, it is a transdisciplinary collaborative approach to improve the health of humans, animals, and the environment, and endorsed by FAO, OIE, and WHO. And this concept has existed actually for centuries, but in our modern world, understanding this independence and collaborative is important for health and safety. So we know that about 70% of the emerging and re-emerging infection is involved with vector-borne and zoonotic. So for raptors, we heard about avian flu and West Nile virus. A lot of study also has been done in this area. And when we talk about One Health, actually it can be applied at international and regional, to national and provincial, district and community. Of course, at the university, the involvement of academic and professional institution. And it's from here, it can go up to the community, national, and go back to the international and regional. It is a various platform to tackle on this information. So many factors have altered our interaction with other living things and our world. Factors such as increasing human population, closer contact with animals and their environment, changes in land use and climate, and increased movement of people, animal, plants, and their products. And then we found that there's new and emerging diseases, antimicrobial resistant development, reliability of our food supply, environmental contamination, other health threats shared by people, animals, and the environment. So whatever we do, we also with the expertise from various universities and colleagues, some studies has been done to look at West Nile virus in Malaysia. This is started at the faculty, and we hope that we can expand more towards raptors and other bird species so that we're able to tackle the problems in the environments, animals, and in human. And also, that's part of my work with my PhD student. We're looking at the antibiotic resistant in Campylobacter jejuni and E. coli in wild birds, chicken, and environment. Hopefully, we can expand this work in raptor species so that we're able to find out about more the information about looking at the zoonotic diseases. So at the end, as a veterinarian, when we treat raptors, our goal is to release the animals to the wild. And also sometimes if it did not happen, so we release it in captivity, so that by doing that, we're able to get help from this animal to share with the public the importance of these raptors for us. So before I end my talks, my conclusion, 3 points that I would like to share, that avian medicine integration in research and conservation of raptors is important, as it is linked the vets, biologists, and other specialists. Research concept in avian medicine in various fields of studies contribute to conservation of raptors. And One Health approach is one of the concepts that would be good to keep in mind when dealing with zoonosis and non-zoonosis cases in raptors. So last, I would like to acknowledge, thank you to my colleague at the Raptor Center, University of Minnesota, and MNS team, our Chumpon trip, Thailand, my Sifu, Kim Chai, Antia, and Dr. Puan, and my UPM AVEX, Avian Exotic Wildlife team, and my students. Thank you very much. Thank you.